So good afternoon friends. We started with diabetes yesterday and we have seen some of the things related to diabetes, what are the reasons, what are their classes, what are the types, and we were to see the complications. There are two important we can have. Hello. That is, there are important complications are there. We can go one by one and we'll see what are the important complications which is affecting the diabetes, or which is affecting the body because of diabetes rather. So first one is a group that is acute metabolic complications. Like example is diabetic ketoacidosis, hyperosmolar, hyperglycemic non-ketonic, this ketotic coma, and hypoglycemia. These are the metabolic complications. We shall see this again. Then others are late complication, that is systemic, that is they are affecting. Example are these are atherosclerosis. If you remember atherosclerosis chapter we have seen earlier, then diabetes is one of the very important risk factors, and in the diabetic conditions the risk of atherosclerosis increased by many-fold. Then diabetic microangiopathy, diabetic nephropathy, diabetic neuropathy, diabetic retinopathy, and infections. These are various these complications which it is making, and that's why, because again somebody should ask, or somebody may ask that that why, what is the problem, why one should worry that there is a increase in the glucose in the blood. So what is the problem? We shall see all this complication, and then we'll understand, even try to see the basic of it, what is the reason behind it. So these are various complications like acute metabolic complication, ketoacidosis, and hypoglycemia are complication of type 1 diabetes. Why hypoglycemia? Again, when treatment is given, and we know that there is a constant balance is important, that is the food, exercise. We know because of exercise the glucose levels changes, because of stress the cortisol level changes, and accordingly the glucose level changes. Then food, the food containing more carbohydrates can change it. So various things are contributing the glucose, and simultaneously we are adding drug for treatment. So when the other factors are controlling, and we are giving treatment in same dose, then there are chances of hypoglycemia. Then another one is very popular one is hyperosmolar hyperglycemic non-ketotic coma. That is there is no ketone bodies are there, just like we have seen ketoacidosis, and it is a complication, particularly is type 2 diabetes. Now let us see one by one. Ketoacidosis is a severe complication where the body produces excess body acids, ketones. Now again, if you remember the glucose metabolism, ketone bodies are formed during this, that is acetone bodies, and these are again one of the important diagnostic tools also. If you have studied or you have performed any experiments, that is urine analysis. Earlier they were part of physiology practicals, anatomy physiology, but nowadays I think they are part of pathophysiology practicals. So here the urine analysis shows presence of ketone bodies, that is a sign of diabetic ketoacidosis. Symptoms are anorexia, nausea, vomiting, deep and fast breathing, mental confusion, and coma. If you remember the topic alcohol, we have seen just recently in CNS, and we have seen the toxicities of formaldehyde, or if we block this dehydrogenase enzyme, and So when you see the this if you remember this, that aldehyde is one of the metabolites, and this, and what are the adverse effects we have seen with formaldehyde or acetaldehyde accumulation, all these are seen here because of the diabetic ketoacidosis. Then next is diabetic microangiopathy. Micro means small, angio are the blood vessels or arteries, and pathy means the problem. It is characterized by a basement membrane thickening of small blood vessels and capillaries of different organs and tissues like skin, skeletal muscle, eyes and kidney. Diabetic nephropathy, that is having renal involvement, is a common complication and leading cause of death is diabetes, is a diabetic nephropathy. Diabetic neuropathy also affect most of the part of the nervous system. Then diabetic retinopathy is a leading cause of the blindness. It causes the damage of retina of the eye, and it also predisposes the patient to early development of cataract and glaucoma. Because of the diabetes, chances of cataract and glaucoma increases. Diabetes also have susceptibility to various infection like tuberculosis, pneumonia, otitis, that is ear infection, and diabetic ulcers. These are again more in these people. So let us see various symptoms. A very nice and pictorial format is there. The person is always tired. Then the diabetic will have frequent urination. Then there will be sudden weight loss. Then wounds will not be healing. Then sexual problems. The person will feel, if you remember Latin terms for that, always hungry, that is, or always eating, that is polyphagia. Always urination is a polyuria. Always thirsty, that is polydipsia. So these are various polys are there which are very. Then blood vision, tingling sensation in the hands or feet because of the nerve damage or nerve problem. Vaginal infections. These are various important signs and symptoms with the diabetes mellitus. These problems, particularly some are initially, some are gradually increasing. It doesn't mean that all signs will be there, but very important signs are always hungry, always thirsty, frequent urination, sudden weight loss, and tired. These 4 or 5 are very, very common and immediately will be observed. Now diagnosis, random glucose level increases. Random means any time when somebody measures glucose is a random glucose. Fasting glucose means we call it as a whenever person has not taken any food, normally early in the morning after almost 12 hours of gap between meals and other food items. So this is in millimole terms, it is 7 millimoles per liter, or in other terms we can have it as a 100 mg per dl, that is 100 milligram per deciliter of blood. Twice a fasting glucose samples are to be confirmed. Then presence of symptoms again are there, at least 2 times glucose samples are there to be taken for that. Then presence of symptoms are checked. As I told you, we have seen these symptoms. Then next is very, very important tool is there, that is called as HbA1c, that is hemoglobin A1c, that is having minimum level should be 6.5 should be there. If it goes beyond that, then it confers diabetes. What is HbA1c? Hemoglobin is there, and that hemoglobin, because of the presence of glucose, the glucose will get attached to the hemoglobin. We call it as a glycosylated. Glyco is a glucose, silated means attached, glycosylated hemoglobin, and particularly it is attached to that portion of hemoglobin. So we call it as HbA1c, that is glycosylated hemoglobin. And this hemoglobin, hemoglobin is present in RBCs. RBCs are having life cycle of 120 days. So whenever this HbA1c is measured, then it shows that this is average for last 3 months, because the RBCs are there. If it is newly formed, then it will not make much impact on HbA1c. But if it is there, that means since 3 months or more, that figures were there, that presence of glycosylated, or that is presence of sugar in blood was there. Because random or fasting, or one more we call it as a postprandial, that is after meal. These three figures, they are basically giving you the timing on that particular day. Now it can be because of many reasons. It can be because of stress, it may be because of the food, it may be because of any other thing. Particularly on borderline, this fluctuation can be very much. But when HbA1c is measured, then it gives clear idea, correct figure, correct information about this, whether this average is there for last 3-4 months, and if it is there, then we can conclude that the person is having diabetes for so many days. Then one more thing is there, that is oral glucose tolerance test, that is OGTT, that is 2 hours of glucose, after 75 gram of glucose is given. 75 gram of glucose is administered to the, and after 2 hours, whatsoever these glucose levels are there, they are measured. Then IGT is impaired glucose tolerance, that is we call this a glucose tolerance, means whatsoever amount of glucose we can take, and it still there is no hyperglycemia, then we call it as a normal glucose tolerance. And then if we take, if it is impaired, then even small level is there. Normal fasting glucose level and OGTT is between 7 to 11 millimoles per liter. So that means we call it as a impaired glucose tolerance. Glucose is not tolerated, and the person will show increase in the glucose level. That means impaired fasting glucose level, when oral glucose tolerance test is less than 7.8, but fasting glucose is around 6.1 to 6.9, then we call it as a impaired fasting glucose levels. So these are various terms which are used, and there are various diagnostic features are there. We have seen earlier risk factors. We have seen genetics as a risk factor. We have seen various causes which will cause the genetical changes. Particularly type 1, we have seen what are the reasons while classification, and we have seen that these all classes will be affecting the people having this type of diabetes. Now in type 2, there are many risk factors. Again genetics is there. We have seen South Asian, Afro-Caribbeans, then Middle Eastern people have more chances. Thus people having physical inactivity are having more chances. Those which are having high this BMI, that is body mass index, they will have. Those who are having history of gestation, I told you earlier, those who are having history of gestational diabetes, they will be obese and they have more chances of that. Then impaired glucose tolerance, impaired fasting glucose, these people are having more chances of that. Steroid use, I told you steroids are what they are, glucocorticoids, and these glucocorticoids are causing the problem. That is, their name indicates they are acting on glucose because they are called as glucocorticoids. Their level, when the glucocorticoids are given, they causes increase in the blood glucose level. Then it can have in females, that is polycystic ovarian syndrome, that is in ovary the cyst will be developed because of this hyperglycemia. Then in the family history there are chances. So we have seen these are what we call as a impaired fasting glucose. That is when there is a elevated fasting plasma glucose. I told you it should be when it is more than 100 and less than 126 milligram per dl, we call it as impaired fasting glucose. So this is we can say that it is sort of pre-diabetic stage, and as soon as it crosses 126 mg per dl, we'll call it as a diabetic stage. Then impaired glucose tolerance, that is elevated 2-hour plasma glucose concentration, which is more than it becomes more than 140 and less than 200 milligram per dl after 75 gram of glucose load on the oral glucose tolerance test in the presence of fasting, this we have seen that fasting glucose levels, which is less than 126 mg per dl. So in that cases, when we test this, when we go for additional studies, then we realize, we understand what kind of situation it is. So we have seen the various signs: polyuria, polyphagia, polydipsia, lethargy, recurrent infection, complication we have seen. And another complications, these are diabetic ketoacidosis and hyperglycemic hyperosmolar non-ketotic coma. These are their cases. Then next is complication. We have seen stroke, myocardial infarction, polyvascular diseases, then retinopathy, xanthelasma, cataract, ophthalmoplegia, then maculopathy. This is macula is a portion, pathy means the problem in that. So these are various problems which are complications are there. Then peripheral neuropathy, diabetic amyotrophy, neuropathic pain, autonomic neuropathy. Neuro is a nephropathy, sorry. Part is neuro means neuron, pathy means the damage or decrease in the function of that. Nephro is a nephron, decrease in the function of that. Then it causes a very typical problem that is called as a diabetic foot. Ulcers are developed in foot, and these are not healing properly. Many times the infection gets into it and that gets converted into gangrene. Gangrene is one of the very severe infectious problem which is not covered, which is not cured with normal antimicrobials, and sometimes the portion of that foot has to be removed because the infection is so big, otherwise the whole body may get infection. So this is the problem. There is a neuropathy, now damage is there, there is a pain, then callus, numbness, deformity, ulcers, and gangrene. Gangrene, I told you, is one of the biggest problem. Gangrene can cause severe damage, and this will result into removal of that much portion. There is no other choice but to remove the portion from that. What are the investigation? We can have various ways by which we can measure blood glucose level. We have got urine dip sticks are there nowadays. They are very simple there. So this urine drop are put into, just like pH paper you people might have seen. So like that, on this pH paper you put a drop of urine, and it will give the signs just like pH, green, orange, red, etc. That means you understand. And they are available for, these urine dips are available for glucose, ketones, and various such what we can say indicators. Then various example of these is BM sticks, ketone sticks, etc. The person should be checked for its ECG, blood pressure, then neurological changes, whether sensation in foot is good or not, how the eyes are, whether eyes are having whether there is a blurriness in eyes or cataract like figure is there. Then this monitoring of this glomerular filtration rate and this renal function test are done, microalbuminuria is done. Injection sites are not getting healed, they are having problem of that because this injury is there and these sites will not be there. Then blood test, I told you there are many blood tests are there, that is HbA1c, I told what it is. Lactate levels are checked because it results into lactic acidosis. pH of the blood has to be checked. Then various markers are there, lipid, liver function test, and various function tests are to be checked. So this will give what are the risk factors into this. There are various risk factors are there. Important is lifestyle. Person should go for weight loss, because we have seen that the diabetic, that is MODY type of diabetes, or where the person is having normal insulin secretion, but because of the obesity and all, there are chances of this chances of this insulin resistance. So for that, weight loss exercise are very good, and it is one of the most important treatment is there. The diabetic people should be educated. The abbreviation for this is a DESMAND, that is diabetic education and self management for ongoing and newly diagnosed diabetes. So DESMOND is a DESMAND, that is a person has to be educated. There are many such programs are being managed by various government or various such organizations for diabetes. There should be self monitoring for the this BMI, that is body mass index. The help from the dietitian should be taken so that low sugar or low carbohydrate diet should be there. Those who are smoking, they should go for smoking cessation, because diabetes plus smoking or alcohol, they add into the chances of complication like atherosclerosis. The foot care guidance should be given, that they should be able to understand these are the basic signs like numbness. We have seen initially that sensation or tingling sensation will be there. These are the initial signs. Slowly there should be the small wounds in the foot, and in that then it can slowly grow up. So this foot care should be suggested, guided, because that should be washed if the injury is there, so that it does not get converted into gangrene. Gangrene is the very severe form of injury. Then eye screening, the control of BP, that is ACI inhibitors, calcium channel blocker, diuretics, whatsoever. We know blood pressure and which drug should be given. And for atherosclerosis, statin, fibrates, this type of drugs should be given so that they don't have any problem. There is a site in UK, that is where they take various diabetic levels and they correlate. If you remember, we have also seen it earlier for these programs for atherosclerosis index. We have seen various scales for that. Similarly, this will be scale, and if you add up into diabetes level and other blood pressure, etc., it can indicate you what can be the chances of atherosclerosis in this or heart diseases in this patient. So that again help patients to understand the severity and to control it. Then you have studied all these drugs earlier in pharmacology, that is what are various drugs. Actually very few people have submitted the assignment. I'll be awaiting this. What are the various drugs which are there, and what are their pros, cons, what is the mechanism of action, and in what condition what is there. This is all given in pharmacology books. You please go through this, how these are acting, and what are their dose, what are their adverse effects, so that it will help us to understand the good and bad things, so that we can consider them in therapeutics. Then these are various drugs. Then what is the treatment? I told you earlier also, the very important thing is a lifestyle intervention. Then metformin plus sulfonylureas, or metformin plus sulfonylurea plus thiazolidine diet, or GLP agonist. You know now all these drugs, because this classification you might, or DDP4 inhibitors, or metformin plus sulfonylurea plus insulin, or increase chances, increase the insulin. Now these are various ways by which we can try, depending on the severity, depending on the responses we can go for, and whatsoever type of references we have got. On that basis we can select the drugs, or their regimens we can select. Again, you might have studied various insulin types, that is what are various insulin types: rapid acting, short acting, intermediate acting, long acting, ultra long acting, pre-mix type of this, and what are their advantage, what are their disadvantage, in what conditions this rapid acting should be used, in what condition the short acting should be used, in what condition and on what basis we call them rapid acting, intermediate or long acting, etc. So you know about it, you please go through this. This is again very important, because whenever we'll see type 1 type of diabetes, then what kind of mix we should be giving, what should be our regimen of insulin. You know about regimen word is used, that is what it should be the frequency and amount of dose to be given. Suppose any dose, any drug is the daily dose is 200 milligram, then regimens means this 200 milligram in how it is given, whether it is given thrice a day, twice a day, once a day, that is called, and for how many days it is given. So the schedule of drug dose, we call it as a regimens. So it can be once nightly, twice a daily, it can be basal bolus. Basal bolus means when that dose is given once, only once, that is called as a basal bolus. Continuous pump, or initially bolus means once only it is given, and continuous pump, this is a latest technologies which are available. I'll suggest you to read all these details about all this, because this is part of pharmacology. I will not go for detailed explanation of this. So what kind of this bolus are there, that has to be studied, that please go through this. Now what should be the prognosis? If it is not treated timely, if it is not there, then the person should have the increased risk of blindness, cardiovascular diseases, then renal failure, etc. These are the chances with T1 diabetes. So in that patients, again it can lead to increase in blood pressure, lipid levels, then body mass and weights. So if we do the treatment timely, and if we can control the blood pressure, lipid levels, body mass and body weight, then we can have the prognostic features. That means that our diabetes treatment is helping, and the person will not have, or the complication will be delayed, or the person can be saved from this complication. The 75% of the patients who are having type 2 diabetes, they will die with the heart disease. We have seen already that these people have more chances of cardiovascular problem. 50% will die with the stroke. Again, these both are atherosclerotic problem, both are the obstruction in the blood vessel, and therefore either stroke or heart diseases are there. Every rise of 1% in HbA1c level causes the increase of the diabetes level, diabetes related to the health risk, by around 21%. That means if so what is the normal level? 6.5 is a normal level. 1%, how much it is? 0.06. So this 0.06, when it is increases, that is 6.5 was the basic, and now it is how much it has become? You add plus, so it becomes 6.56. So in that case, there is a chances of increase in the risk of diabetes related death by about 21%, particularly when it goes above 7 and up, then it is the rate increases. Various cases are there, we shall see later. Then medical emergencies, we have seen 3 important emergencies we have seen. One is diabetic ketoacidosis, then coma, and third one is hypoglycemia. What happens? Hypoglycemia, particularly as I told you, when simultaneously the person goes for more exercise, less carbohydrate diet, and बघायला सांगितलं बघतो ठीक आहे. हा करतो. Now, what happens? I told you that when person is given treatment, any kind of treatment is given. And in that patient, when we go for the drug and already the treatment is being there, the person follows very strict diet that day. The person goes for exercise, and because of all these factors, already his blood glucose is in control. And when we give any drug for lowering the blood glucose level, it can reduce it than normal. And when it reduces than normal, then what are the symptoms that can be seen? So it can show the seizures, it can show the clammy skin, sweaty, tachycardia, behavior change, slurred speech, shaking. So it shows signs of confusion, etc. And if it is identified initially, it is fine. Otherwise, it can result into problem. The strict this basal metabolic rate control should be there. No alcohol. If there is malabsorption, renal failure, medication, lipohypertrophy, hypothyroidism. So in that cases, this problem with the hypoglycemia will increases too much, and in that cases, immediately the patient or the person should be given with the glucose. It in any form, if possible, give glucotab, that is tablet of glucose, or give just a simple glucon D like thing which is there. Around 10 to 20 gram, or give the glucose juice, or there are some glucose gel is available. 10% dextrose IV if you have got nearby hospital. Give injection of glucagon. Glucagon is opposite to insulin, and in that cases immediately it should be there. If the person has reached into coma or severe inflammation of brain is there, or we call it as a meningitis, like, then give for cerebral edema, give mannitol, which is very good reliever of this cerebral edema. Give dexamethasone like drug. And again, problem with the dexamethasone, yes, we can give dexamethasone because it is a hypoglycemia which has resulted into this. Dexamethasone itself can cause increase in blood glucose sugar. Then another medical emergency, what we should do in that, it is a diabetic ketoacidosis. We have seen it, it is usually with the type 1 type of diabetes, and in that what can be there? We can see there is a hyperglycemia, there is a ketonemia, that is presence of ketones in the blood. I told you in pathophysiology practical urine analysis you may learn this. Ketoacidosis, that is what will happen, that is pH of the blood is decreased. Normally it is a neutral pH, or it is around 7.4 to 7. It will go towards acidic way, it can become more acidic. The level of ketones will be more than 3 millimoles per liter. Then this basal metabolism will be more than 11, pH will be less than 7.3. Then the that is levels of bicarbonate, that is HCO3, will be less than 15. We have seen, I told you pH is 7.4. So why it is there? It is triggered by stress like infection, poor compliance, endocrine crisis, cardiovascular diseases, alcohol, and other some medications they may cause. Particularly it is more found in type 1 type of diabetes. What are the signs? Again, here the signs will be same like polydipsia, polyuria, weight loss, lethargy, vomiting, abdominal pain. Then we call it as a Kusumal's respiration. Respiration will be very deep and abnormal type of respiration that is there. That is shallow and occasional breathing is there. We call it is also called, this shallow occasional breathing is also called as a Kusumal's respiration. Then it can have normal cognition levels will be changed. General cognition situation will be different. and the person will have confusions. The because of more polyuria, there will be dehydration. The mucous membrane can get dry, and there will be reduced skin trigger. The eyes become sunken. Sunken means just what we can say it. That is, I'll try to show you picture rather. Then the tachycardia, low blood pressure, poor drop breath, breath will not be proper one. Sign of infections like fever, crackles, cellulitis will be there, and increase in the osmolality will be there. The osmotic pressure will be increased in these patients. What are the specific investigation we should go for? We have seen again, go for the serial checking of these levels of that ketone levels to be checked. Then serial levels of arterial blood gas or venal blood gas should be checked. Then septic screen should be done for various sepsis. Then this troponin T and creatinine kinase should be checked. We have seen these as a biomarkers in myocardial infarction. ECG should be checked, amylase level should be checked, CT of head should be done for this. Monitor this basal metabolism, ketone levels, acidosis, mental state, fluid status. It has to be monitored because it is a severe condition, and this will whole change homeostatic mechanism of the person. How the person has resuscitation means saving the person from that emergency. That is, suppose somebody is drowning, then resuscitation means we are saving, and because of that the person is almost in the danger of death. So resuscitation means sort of, we can say, bringing back from the death is a resuscitation. So this resuscitation is the almost on the in the line of death. Once the line is crossed, the person can die. Just before that, we are trying to take him back, is called as a resuscitation. So what are the signs, what are the treatment we have to do? Go for fast sodium chloride treatment initially, because osmotic pressure has changed, and therefore give it. Fixed rate insulin should be given so that the increase in the blood glucose level can be monitored. It should be given 0.1 unit per kilogram. Reduce this BM, that is basal metabolism, around 3 per hour to avoid, because this basal metabolism rate because of the increase in the glucose will be there. So we have to reduce, we have to bring it towards 3 to avoid the cerebral edema. Continue baseline long acting insulin till we get normal blood glucose level. Sodium chloride plus potassium chloride should be given. Why this? Because we have seen polyuria is there. Polyuria, because of that the ions will be lost in the urine, and if the ions are less, this will cause decrease in the ion levels, and it can be very dangerous one. If you are read or if you remember the topics, that is in inorganic chemistry, various ions, okay, essential and trace ions, if you remember, then you can understand the situation of the give 10% of the glucose when the BM is less than 14. Treat underlying causes for that. Once this person is going for the normal, this one, then convert back to the normal, then this dextrose and saline normal. Indications, check for hemodynamic instability, cardiogenic shock, respiratory failure, because this person may be in coma, severe acidosis, coma. So check it, and if everything is there, then go for such kind of treatment. So this is very important in this diabetic ketoacidosis treatment. What are the complications with this diabetic ketoacidosis? Cerebral edema. We have seen mannitol as a treatment for that. Confusion, urinary incontinence, coma. Coma is the main mortality reason in children. Hypoglycemia may cause arrhythmias and comas. Hypokalemia can cause cardiac arrhythmia. Then this ventral this ventricular tachyarrhythmias are there, retinopathy will be there. Then acute respiratory distress, ARDS means acute respiratory distress syndrome will be there in that, and this will have problem in the lungs. Acute respiratory distress means the respiration will, we have seen that shallow and this typical breathing it will be making. Okay, so it will be there because of the pulmonary edema that can be checked, and prognosis worsen with the age, and low glucose concentrations, low glucose control into it, so it will be worsening. Prognosis means the chances of getting better. So prognosis worsening means the person will have very little chance to get better, and the last one it can result into death. There is another medical emergency we have seen. These are three important medical emergency in diabetes. One is we have seen hypoglycemia. Second we have seen is diabetic ketoacidosis. Particularly it is more seen with the type 1 type of diabetes. It is not that much, or it is not prevalent in type 2 diabetes. And third one is the medical emergency with HONK, that is hyperosmolarity, high serum osmolarity, and there is no ketosis. So hyperosmolar is HO and no ketosis is there. There is osmotic diuretics is there, therefore there is a intracellular dehydration. Because of that it causes infections, poor basal metabolic rate control. It can result into myocardial infarction, it can cause cardiovascular accidents or stroke we call rather, endocrine crisis, acute abdominal pain, medications problems, medication which can be given are metformin is there. Alcohol has to be withdrawn or no alcohol. In what cases the problems are there? In old age, dementias are chances. We have seen just now dementia, we have seen Alzheimer's, so that there are very high chances of dementia, and if the steroid is used again, means depend two things. One is steroid is going on, then glucose control will be problem, and whenever there is inflammation, we have seen dexamethasone we have given in hypoglycemia, then we can use steroids. So we have to use the steroid in very judicious conditions. If there is inflammation, then we can use it. If it is no inflammation and it is required, if mannitol is there, mannitol should be used first. Then it can cause severe dehydration, low glucose control situations. Then in that cases confusion, seizures can be there. Person will have lethargy, weaknesses, and abdominal pain. These are then few more signs it can be seen. So it can be having additional status. So in that case we have to give this fluid resuscitation, give more fluid. We have seen saline and all. Then give potassium chloride. Variable rate insulin should be given for that. Treat underlying causes, review the medication. Low molecular weight heparin can be given to avoid the complications of thrombosis in these patients, because it can cause, we have seen it can cause myocardial infarction, it can cause stroke. So in that cases this care has to be taken. So here we finish important portion or basic information about diabetes. We shall see now various treatment algorithms or various drugs treatment which is done for diabetes. Now as I told you, I repeat, I will not tell you about mechanism of action, only will check now which drugs are preferred in what conditions, or what are the first line, what are the second line drugs. So this will only our next this one. And we have already seen various treatments for the diabetes complication. Example, we have seen treatment for diabetic ketoacidosis. So you should go for what is the treatment for diabetic ketoacidosis, in what condition what treatment should be done. Then treatment for this hypoglycemia, in what condition there can be hypoglycemia, what are the signs symptoms of hypoglycemia, and what treatment we have to do for hypoglycemia. And lastly, hyperosmotic non-ketotic syndrome, that is HONK syndrome. Again, what are the signs symptoms of it, why it causes, and what are the treatment. We have seen all these treatments. Only we shall be seeing various type 1, type 2 diabetes treatments, treatment for insulin resistance and all. So this will give us the idea about various drugs which should be preferred in the diabetes treatment. So you please go through this. If you have any difficulty, you can ask. Okay, take care.